A dream was finally realized recently when the first Pediatric Accident and Emergency Department was opened at the Eric Williams Medical Sciences Complex. This emergency department will offer exclusive care to the children of our nation. The unit will cater to the trauma cases and other health issues in timely fashion. The medical staff is also pleased now that their children can be seen in a faster and more efficient manner with the latest life-saving and monitoring equipment. For the parents, it's a relief to know their children can be attended to in an emergency department that's exclusively for treating children.
Now the new is much more improved and everything. The safety, the ladies on the ward and the on the ward are very good.
According to Dr. Victor Tirapalli, who works in the department, the new facility is among the best in the world.
Luckily, I was one of the few doctors who had made a lot of hospital transfers with sick babies, and I happened to see all the ERs and the ICUs in the US, and our department here is no less far behind. We're almost on par with any other A&E.
Another significant investment was made in the health and well-being of our nation's neonatal and other babies who require very special care and treatment.
It's a bigger space. To start with, there's a separate ramp to enter. There are two big waiting rooms, so we have separate waiting areas. We've also got some additional rooms we didn't have before. We have an asthma room that's completely allocated to the asthmatics. We've doubled our crash room. We used to have one for very critical patients. We now have two, and that has served us just in the time that we've been here. It's become very useful. We also have a dental facility. Because of our triage system, and our triage system has just recently been revamped again, we are able to identify the sicker patients and see them faster. The patients who are not critical or perhaps who have minor illnesses and injuries may not necessarily be seen faster on a very heavy day. But it's something that we find very difficult for patients to understand, that it's not a first come, first served service. You're seen depending on your need.
The opening of this pediatric department symbolizes the continual commitment of the government to the care of young children. This unit will cater to the needs of trauma cases in a timely manner. Children will now have their own dedicated area with equipment and services especially designed to accommodate their unique needs. I'm indeed pleased to be part of such an exciting and momentous occasion.
In the true spirit of partnership between the private and non-governmental sector, the Eric Williams Medical Sciences staff and the Just Because Foundation demonstrated that we can make a difference when we work together. This collaboration led to a new pediatric ward specifically for children with cancer. This ward was designed so that our children would now have a dedicated and comfortable environment where they can receive medical, social, and emotional support from their loved ones and from the medical team.
It's like a home away from home. You can talk to other parents, you can talk to the Noel and Siobhan, who are responsible for this ward, and they are like good counselors. They comfort you when you want to cry. You can cry on their shoulder. You can talk to them about anything, and this is what a lot of parents need, to feel a little more welcome, a little more warmth, when they're going through situations such as me and my son having to deal with cancer. Right? And it has been a bit hard, but yet, people just ask, why do you have a smile on your face and you're going through this? And when I study about how they went through it and look at what they are doing for others, right? It helps brings a nice warmth to know that, okay, they can go through it and have such strong encouragement to give. Why can't I do it too?
It's the intention that all children will be given equal opportunity to receive the best care available in the public health sector.